Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Rhonda Brooks. It's Friday, October 10th. Today on HITshow, hospitals are doubling down on outpatient strategy and system-wide expansion. Nurses are earning national recognition for innovation, and we'll look at how AI investment is shifting from pilots to profits. Let's get started. Hospitals are rethinking their footprints, and ambulatory surgical centers are right at the center of that strategy. Here's Teresa Vaughn.
According to a new report from Colliers, the number of ASCs under national operator partnerships has climbed from about 1,339 in 2011 to over 2,100 today. Large operators in this space now include United Surgical Partners International, Surgical Care Affiliates, AmSurg, and Surg Center Development. HCA Healthcare is also cited among the more significant players. Hospitals increasingly view ASCs not just as cost centers, but as strategic assets, expanding outpatient capacity, accelerating turnover, and protecting margins in an era of tighter reimbursement.
For people who don't follow the business side, what's driving this shift away from traditional inpatient settings?
Two things really: economics and consumer demand. Outpatient surgeries cost 30 to 50% less than hospital procedures, so payers and patients both push for them. Meanwhile, hospitals free up beds for higher acuity cases and capture new revenue through joint ventures with national ASC operators. It's become a win-win for systems trying to stay profitable under reimbursement pressure.
Teresa, how does this affect staffing and strategy?
It's driving new workforce models. Hospitals are sharing nursing teams and revenue management staff across inpatient and outpatient sites. It's about flexibility and throughput, not just location.
That focus on footprint leads us to Texas, where one health system is going big. Very big. Teresa, tell us what is happening in San Antonio.
San Antonio Methodist Healthcare says it's in the middle of the largest expansion in its 60-year history. The system is investing nearly $450 million across multiple campuses, including a $200 million downtown renovation and $104 million for Stone Oak Hospital's two-floor addition. 3 new hospitals have opened since 2023, and the plan includes hundreds of new beds, expanded ICUs, and parking capacity to match.
That's a huge commitment. What's driving it?
Population growth and aging infrastructure. Methodist leaders say it's also about positioning for the next decade of care delivery, balancing inpatient demand with outpatient expansion in fast-growing suburbs.
From large-scale expansion to a single hospital making national headlines, nurses at Atrium Health Union are getting well-deserved recognition. Jade Romero joins us.
Atrium Health Union in Monroe, North Carolina has been honored with the 2025 ANCC Pathway Award, sponsored by Press Ganey. The award recognizes organizations that advance innovation and promote a positive practice setting for nurses. Atrium's winning initiative leverages AI-driven tools to streamline nursing workflows and improve bedside documentation. Leaders say the program has boosted retention and created a culture where technology enhances rather than overloads clinical work.
Jade, it's encouraging to see nurses driving innovation. Does this tie into the broader trend of nurses shaping AI design?
Absolutely. We're seeing more nurse-led tech pilots and even product partnerships where frontline experience is informing how digital tools get built and deployed.
I love nurses. They are the lifeblood and circulatory system of healthcare. When we come back, nurses are taking the lead in shaping the next generation of AI tools, and that movement is growing internationally. We'll look at how new collaborations and technologies, from hands-free charting to conversational automation, are changing how care teams actually get the work done. Stay with us.
HITshow is made possible by EY, a globally connected, multidisciplinary professional services organization driven by innovation and action for the long term. An optimistic future where business, people, society, and the planet thrive. EY can help you shape the future with confidence.
Welcome back. You're listening to HITshow. I'm Rhonda Brooks. Back to the front lines now. Nurses are taking a more direct role in how AI assistants are built and tested, reshaping healthcare from the ground up. Anika Shah has the details.
Suki, a leader in voice-based AI assistants, has launched a nursing consortium to help shape the future of clinical documentation tools. The initiative brings together nurse leaders from across the US, Canada, and the UK, all focused on improving how AI integrates into real electronic health record workflows. It's a recognition that nurses make up the largest share of clinical users, yet historically have had the least input into system design.
And they're looking for practical bedside solutions, not just pilots.
Suki's goal is to capture daily pain points, from shift change documentation to patient education notes, and feed those insights directly into the product roadmap. Company leaders say it's about co-designing the AI experience so it feels less like technology imposed on nurses and more like technology built with them. It's the latest signal that frontline clinicians are shaping AI development on a global scale.
Thanks, Anika. Staying on the AI theme, Nate Collier brings us a story focused on automation.
Healthcare AI platform Notable has launched Flow AI, a conversational assistant that lets teams design and modify automation workflows using natural language. Users can say things like add a filter for lab results or merge these data inputs, and the system handles the coding behind the scenes.
Nate, that sounds like it could change who gets to automate tasks.
That's the idea. Flow AI bridges the gap between clinical operations and IT, speeding deployment and freeing developers to focus on more complex projects.
Of course, all these AI investments raise a bigger question. Are they finally paying off? That brings us to Logan Stokes' ongoing research in that area. What do you have for us today, Logan?
A new joint study from Bain and KLAS research confirms what many in the industry have been sensing. AI is graduating from proof of concept to production. We've covered the surge in clinical workflow pilots, but this report quantifies something new: the scale of dollars moving into revenue cycle automation and financial optimization. Hospitals aren't just testing AI anymore. They're deploying it to capture denials, accelerate billing, and protect margins in an unforgiving reimbursement climate. On the payer side, investments are concentrating in care coordination and utilization management, aimed squarely at controlling medical loss ratios and tightening the connection between data and dollars.
So the focus now is ROI, not R&D.
Exactly. The report calls it a proof of value moment. Executives are done chasing headlines. They want measurable savings, faster documentation, and improved throughput. It's a more disciplined, financially driven phase for healthcare AI, one that rewards projects showing real operational lift rather than technical novelty.
Next week, we have conversations lined up with more financial analysts, and we'll ask them about the impact we might see on balance sheets in the fourth quarter. And before we close today, a bright spot, a different kind of leadership story making national headlines, and we'd like to recognize the exemplary efforts of one large health system, Northwell. Peter Betterworth reports.
Gun violence. In the U.S., firearm deaths among children have surged. One study shows a 41.6% jump in child firearm deaths between 2018 and 2021. Gun violence now claims more children's lives than car crashes. Northwell Health has long positioned gun violence as a public health crisis, not a political issue. Their Center for Gun Violence Prevention leads research, hospital protocols, and national education efforts. This year, at their 6th annual Gun Violence Prevention Forum, Northwell collaborated with the Ad Council to launch a new campaign called Agree to Agree. The campaign aims to rally nonpartisan action, especially among parents, clinicians, and community leaders, fostering consensus on things like safe storage, screening for firearm risk, and community prevention.
Gun violence is one of the toughest public health challenges of our time, and Northwell's persistence reminds us that health systems can do more than treat the aftermath. They can lead prevention, education, and change. It's leadership with heart and courage, and we're grateful for Northwell's inspiring work. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Health 2025, the epicenter of healthcare innovation, where the future of care happens, October 26 through 29 in Las Vegas. And by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, kimchi.com.